Thank you. I'm just going to add a few comments additionally from a medical point of view, but I'm not going to repeat points that have already been made. And the first thing is to make an obvious point that this is now a very global disease. And the way you deal with global pandemics is different in public terms, health terms, than the way you would deal with a localized outbreak where you're the first country or a very significant region that has got it. And the second point is the obvious point again, that in this country, this disease is now accelerating up the curve, but it is still at a low level, but it will accelerate up now really quite rapidly. Now, we obviously need to do things that are both effective, and all the measures that are here have been gone over by several large numbers of scientists in different ways, looking at mathematical models, behavioural sciences, many other forms of science to find the things which are the most effective, but they also have to be sustainable, because this is going to go on for some time. And I think we should not be under any illusions that if we just do this for a couple of weeks, that is sufficient. This is going to have to be a prolonged period. Now, for any individual person, let me start off with the most cheery point about this. For any individual person, the chances of dying from coronavirus are actually very low. Some people will not get the infection, and many of the measures we're doing at the moment will help with that. Some people will get it and will have no symptoms at all. They won't even realise they've had it. Of those who do have symptoms, the majority will have either a mild disease or a moderate disease, meaning they can easily manage it at home without having to go to the NHS directly or indirectly in any other way. But obviously, a small minority, but a significant one, get significant disease requiring hospital care. A small proportion of those will go on to need intensive care, and sadly, some people will go on to die. And as we've discussed before, the overall mortality rate looks as if it's a bit less than 1% on current data, but that's without knowing how many people get the disease asymptomatically. But we know some people get it. Now, we also know that older people are at greater risk, and that is widely known. But it is important, I think, to stress that being old does not necessarily mean you'll get it worse. And actually, there was a rather nice article by my minister, Nadine Dorries, who actually explained when she had coronavirus, her mother, who caught it from her, had it more mildly. So it's not a necessary fact that older people will necessarily have it worse. So you might say, why with a disease where we have such small numbers at the moment and which the great majority of people are going to recover from, and most of them will have a mild or non-noticeable disease, would we want to do anything at all? And the reason is this acceleration. And our overall aim and our single aim is to reduce death rates and the numbers of people who might die as a result of this. But I think it's important to recognise, and the reason I'm explaining this is so people understand the logic of what we're doing, that there are broadly three groups of deaths and other impacts on health we need to consider. There are the direct deaths, which are caused by the coronavirus disease itself. With good medical care, tragically, a few people, the great majority of them in less good health, but not necessarily all, will pass away. There are, however, and this is really important, a significant number of other deaths which, if the NHS became overwhelmed in any of the four nations, if the intensive care units got to the point when they were overwhelmed, then people would die from indirect deaths because they did not have the ability to get medical care. And a lot of what we are trying to do is trying to reduce the chance that those indirect deaths might occur. And then the third possibility, and it is an important one for us to consider, is that some of the measures we are doing will undoubtedly, or could have, negative impacts on people's health themselves. So there are negative effects of what we do to try and combat the coronavirus. One of the reasons we are very keen not to go in advance of need was because of those negative facts, and I'll come on to one of them later on. Now, just to explain where the different things fall into this, the very profound changes in terms of social distancing that the Prime Minister laid out, which are going to be very difficult for people to maintain over a long period of time and will have very significant social effects, do have the capacity significantly to pull down the peak of this infection wave and therefore make it easier for the NHS and particularly the ventilation support to be able to cope with the wave that is heading its way. So that is really critical. People who do this, who restrict their social gathering, are doing things to protect the NHS, to allow the NHS to treat both people with coronavirus and people who have other things as well. It is overall effect on the NHS. This is the second group of things which the Prime Minister has laid out, are those things that we want the quite large group of people who either are over 70, possibly quite healthy or very healthy, over 70 but over 70, or who are younger than 70 but have a significant health condition, and this is mainly in adults. We want them to take even greater care, because this is in addition to making sure that they don't end up helping fuel the epidemic themselves. It means they do not have to go to hospital, which is good for the NHS, but most importantly, it reduces the risk that they will catch the virus, particularly at a time when the NHS is under strain. This is absolutely critical. And the group of people who we want to take this advice particularly seriously are older people above 70, people who in adult life would normally be advised to have the flu vaccination. So these are people with chronic diseases, such as chronic heart disease or chronic kidney disease. And also as a precautionary measure, because we are early in our understanding of this virus, and we want to be sure, women who are pregnant. And those three groups are the groups we want to take particular care to minimise their social contact, which will, of course, will have very significant risks for them. And later on, we will be giving very shortly, a much more specific list of an even smaller group of people who have very profound health problems. They all know they've got very profound health problems. For example, people who might have advanced myeloma or leukemia, things that significantly affect their immune system. The final bit that is being talked about today is, in addition to what we've previously talked about, is the 14 days stay at home. If one person in the household has symptoms, the whole household stays at home. Now, there has to be some common sense around this. If there's a very vulnerable person in the household, for example, people will need to take that into account. We'll need to think, people need to think through the practicalities of their own position. But the reason for this is because they are helping to stop it be transmitted onto the rest of the community. And these people, the trouble is, if you actually are in a household with someone who's got coronavirus, there is a reasonably high chance you will be infected and will go on to get this. So this is, in a sense, something people are doing to help protect the rest of society. We do want to stress that the great majority of these people will have mild or moderate disease. They don't need to contact the NHS. They can use the NHS online service. There's very extensive information there. We really would encourage them not, if they have mild or moderate disease, to phone 111, because the service we need to protect for those who are in greatest need. But, really important to stress, if anybody's health starts to deteriorate significantly, then they should phone 111 or contact the health services in the way they usually would. So this is, if people deteriorate, we want to make it clear they should then do so. Finally, I just want to make a point on behalf of my other CMOs for all 4 nations. We are enormously proud of what our colleagues in the NHS and public health have done so far to delay this and to do so in a safe way. And an enormous amount of work has gone on to do that. The next few weeks and months are going to be extraordinarily difficult for the NHS in all 4 nations. We know that our colleagues will rise to this challenge, but we know it is going to be very hard indeed, but we have enormous faith in them. Thank you very much.
Well, thank you very much, Chris. Well, I want to thank both Chris and Patrick immensely for all the work that they've been doing over the last few weeks and months. And I know it's a big imposition, but we're going to be making sure that we give daily updates to you. Well, I do think that would be that would be valuable, so that we can have, as I said from the beginning, as much transparency as possible, and really try and show our working and our thinking as clearly as possible to the British public. Questions now, please. Vicky Young, BBC.